To answer that question, so I think if I divide the various structures in the foot and ankle, then I think it will become very easy for people to understand. So first important structure is fascia, and the fascia is like a band that connect bones. And the most common injury related to fascia, overuse injury or runners, is plantar fasciitis, the commonest cause of heel pain. The second structure would be ligament, and the lateral or the outer ligament that is quite predisposed to injury by a simple ankle sprain when the foot goes inwards. So ankle sprain is the second commonest injury in foot and ankle, and maybe one of the most common sporting injury overall. The third structure would be nerve. The commonest issue in foot in relation to a nerve is trapped nerve, also called as Morton's neuroma, and that's more like a pebble in the foot, or you're walking on a marble, that sort of feeling. So that's more like a thickened trapped nerve, which causes pain when there is increased pressure. The fourth structure, then we come to bone. So what is the commonest bone injury in sports and exercise area? So people who are sportsmen, stress fracture or fracture itself. And one of the commonest fractures is fifth metatarsal fracture or Jones fracture. One can get stress fracture, and that is that could be due to faulty running style, inappropriate footwear, etc. And then the next structure is joint. So commonest pathology in sporting population related to joint is either an impingement syndrome. So it could be impingement in the front of the ankle, which is anti-impingement, or at the back, which is posterior impingement. Anti-impingement is very common in footballers, so it's also called sometimes footballer's ankle, whereas posterior impingement is common in dancers. And then last but not the least is the tendon. So the tendon, which the most important tendon in the foot is tibialis posterior tendon. And I see quite often runners who come having issues with the tibialis posterior tendon problems, either in form of inflammation or even a torn tendon. So these are the commonest foot and ankle injuries in sports. So one has to carefully assess the patient. So a thorough examination, and before that, a very good history, listening to the patient is important. And after that, one decides if they need investigation, or if they need investigation, what investigation they need. So just an example to you is heel pain or plantar fasciitis can often be diagnosed just in 5 seconds with the history, and the classical history is first step pain. So the patient says that when I get out of the bed, I can't put my heel down on the ground because it's so painful. Or if I'm sitting, I stand up, I can't walk. And 99.9% of times, this we are dealing with plantar fasciitis. And you can choose then if you want to investigate. Why do you want to investigate? And sometimes, if you're confident with your clinical diagnosis, you do not need expensive diagnostic tools. The other example of history is if somebody comes to me and say that they were playing football or basketball or tennis, and it felt to them that somebody had kicked them in the calf, but when they looked back, there was nobody behind them. And then they could not put weight on their foot, which felt like it was kicked. And this is almost always the history for Achilles rupture. Obviously, once you've got the suspicion, you need to get your examination towards that end. And by and large, you don't need to investigate every Achilles rupture, but then when you're thinking that you might need surgery or the diagnosis is in doubt, then you need imaging such as ultrasound scan or MRI scan. If somebody comes with ligament injury, which is not improved with time, then those are the patients I would certainly do an MRI scan, because I just want to make sure that they have got grade 3 or severe grade 2 ligament injury, as well as they haven't got anything associated with it, such as a cartilage injury or osteochondral lesion. So I hope that is what you were looking for. Unfortunately, I don't think there is a very fast route. Foot and ankle injuries can sometimes take a long time to heal, and you can try to expedite, but still one needs to be patient with these injuries. Um, in short, it's a complex question, but in short, I think once you need to establish the correct diagnosis, because without diagnosis you cannot treat. Once you have established the right diagnosis, then obviously it depends on the patients. You discuss with them whether they are suitable for injection or physiotherapy or insoles or surgery. Now you can imagine surgery will take the longest time because after surgery you need recovery. But all in all, I would say that if you, depending on what modality we are talking about, and then after that we have got appropriate rehab in place. And I often say to my patients that I have operated, my job is over, but now it is between you and your physiotherapist. They are the key element. And if you got a dedicated patient and if you got a good physiotherapist, then I think half the battle is won after the operation. So these are the usual, timelines, and each pathology, as I said to you, foot and ankle is so diverse. We cannot just say one figure for each and everything. Everything is so different and depends on variable for the patient, individual patient as well. Sometimes to aid recovery, I use shockwave therapy, which I find quite useful, especially for things such as plantar fasciitis or Achilles tendon problems, or sometimes if there is a delayed bone healing, then you can use shockwave therapy, which could be a good adjunct. Modern days now, people are coming with demanding more and more, and we started using platelet-rich plasma. There is some evidence that platelet-rich plasma can accelerate healing, and we can use sometimes that as an adjunct. So these are the ways for faster recovery. So you should see a specialist after a sports-related injury if you have been struggling for a long time and you've done your exercises, you've seen physio, you've seen podiatry, and still there is no improvement, then I think certainly you need to see a specialist. Or it is such an injury. So, for example, if you're an elite runner and you have sustained Jones fracture or Achilles rupture, I think those are the cases where specialist input comes more into, sooner you get it, the better it is. Or, for example, as I was saying, tendon disorder, so tibialis posterior tendon problem. Because if you wait on these cases, these can progress and you don't want it to become worse. So those are the ones I would say either not getting better with the conventional treatment or the specific injuries which I mentioned, or when the diagnosis is in doubt or there's no diagnosis, then those are the cases where specialist opinion must be taken. That's a very good question. And I think it's simple adjuncts, use of good footwear. So your shoes, running shoes, playing shoes should have a very decent support underneath. If not, then it gives rise to so many things such as plantar fasciitis, Morton's neuroma, etc. The second is roomy shoes. So you don't want to have too tight shoes. They should be tight enough for adequate support, but they should not be a size smaller or things like that. Otherwise, you'll end up with pain in your forefoot due to the pressure on the nerve. Some people have flat feet. Now, this flat feet is not at all pathological in quite a lot of patients, but sometimes it does need to be supported by insoles. So use of insoles when and where required is a very good adjunct to prevent injuries so that you don't put extra pressure on one side. And other than that, if you are taking a gap and then you're going back, you need to take your time. You should not suddenly go and do a sprint. because I've recently seen a patient like that who, after London Marathon, um, she ran and she just tried to complete it, and then she's now struggling paying the price. Or I've seen patients who did not play tennis for a while and straight away went and then ended up rupturing their Achilles tendon. So getting gradually into these sports or run, and also most important, not the least, we all know that warming up properly before you get into the actual action or heat, that prevents injuries. So these are the simple adjuncts.